of EMS calls. So call 911, ambulance is dispatched to a potential opioid overdose. We're actually seeing an increase in the past 2 to 3 years of those EMS calls for opioid overdoses. At the same time, we're seeing a decrease in transfers or transport to emergency departments by EMS units. So more EMS calls, but less transports to emergency rooms for overdoses. And I think the key here is that our frontline our first responders in EMS crews are making saves. Most likely they're delivering naloxone and are reversing overdoses on the scene. And oftentimes they are declined transport, not transporting, and individuals aren't finding the need to go to the emergency room after that. In the past year in particular, this data has a lot of ups and downs, peaks, and I think that's because of our low numbers. But over the past year, we've seen a lot more naloxone saves. So I think this represents the good work that we're doing in getting naloxone out there, getting our first responders, our frontline personnel trained to use naloxone, and we're seeing saves because of it. So that data from the state is showing us that we've improved prescribing practices. We've got good and improving access to treatment services. We're having some effect in our response, but there's data that we still don't have, and we can't quite characterize how well we're doing in our primary care and urgent care systems. We need better data on our behavioral health resources and our resources to support social determinants of health that help folks with recovery. We've got the need for more timely data. This data from the DOH lags by 2 to 3 years at times, and so it's not adequate to drive our interventions. It's not giving us the information we need in real time to respond more urgently. And then ultimately, we know we have good peer navigator and recovery coach programs, but we need data on how to most effectively use those, where to fill in gaps, and how to improve those resources. So success we have, again, better prescribing, increasing treatment services, our access to pre-hospital emergency services is, I'd say, a success and one that we need to grow from. And we've got strong recovery networks and support systems, but still gaps and open opportunities for improvement. So improving data is one of our key priorities, and local data that can drive interventions is something that our teams are working on, that we need to work with local partners in healthcare, 911 dispatch, our EMS services, and other community partners to fill out the data to better drive our interventions and our programs as we plan ahead. We also need a better survey of local and regional resources, both behavioral health and healthcare resources, but an analysis of where there are gaps and where we need to fill in to better intervene, support the programs that we've got up and running, but also recognize where people are unable to receive services and where we need to make improvements there. So next steps I'd like to see us make in talking with some of our leaders in behavioral health and our substance use disorder response teams within our department, as well as with community groups. We certainly want to be on top of better data. So pulling from DOH resources, data resources that we can get from the state, and then improving current systems to report overdoses, I think can be improved. We've got healthcare partners, we've got behavioral health services that see opioids on a regular basis. We don't get enough of those reports, so we want to improve those systems and make them easier so that we can respond in real time. I'd like to review our opioid death data. It's, as we've discussed, hard to get that from the state, but I think collaborating locally, if we get better reporting in real time, we can do a better job of reviewing overdoses, reviewing deaths that are caused by overdoses, and inform our community partners on how best to respond there. Mapping systems. We're doing work to map recovery programs, behavioral health access. I know a lot of our partners thriving together and several of the county, other local health jurisdictions are doing mapping projects to identify what resources are needed in what areas of the region. Again, building off of the current success of our emergency response systems, it needs to be a key priority. Now, we've got good naloxone distribution and training, but I think we can get that out to more people. And then more and more people are asking if naloxone can be left behind after an overdose so that other people can be treated. And other EMS systems across the state are exploring leave behind buprenorphine or actually treatment services and enabling access to treatment services after overdoses are encountered. And I think that's something our EMS systems have expressed interest in and are looking forward to being supported in those responses. And then ultimately, we need to expand and improve the work that many of our recovery services are already doing. They're guiding us in many ways, helping us to recognize what individuals who are seeking recovery truly need. And the access points that they offer really need to be expanded so that we can help anyone who needs access to recovery, access to treatment, to be able to access that no matter where they present themselves and at whatever time they are ready for entry into services. Real quick, from a respiratory illness perspective, we aren't seeing as much influenza or other respiratory illnesses as southern western states or a lot of states further east. But across Washington, we are seeing an increase in influenza, increase in RSV. Emergency room visits are up about 25%, and hospitalizations because of RSV are up 75% on the state level. We haven't seen quite that rise in talking with healthcare partners in our region, but the data that we've got from our respiratory illness dashboard suggests we are seeing an increase in influenza. It's comprising 1.4% of emergency room visits, and then RSV is about 0.5% of emergency room visits. So both those rising, fortunately not as high as previous years, but we're watching it closely. And in conversation with our healthcare partners, a lot are putting in place precautions to prepare for the season and then to respond when they're seeing it in greater force than they are now. So that's the presentation I've got today. Happy to answer questions and continue on in our conversation.
Questions? Go ahead, Bill.
Dr. Wallace, Bill Sullivan here. So with regards to opioids and overdose deaths, I mean, we talked about this a little bit last month. We're talking about 30% of preventable deaths in our county with a trend that's going upward sharply, and those data are 2 to 3 years old. So this is I think what you call a public health crisis, right? And then for 2 years I've been sitting here trying to figure out what it is that is the health department's role in the opioid epidemic. It's not a criticism of you, but I'm hearing terms that are really broad, like map people to resources and collect data, things of that nature. I don't understand what department within or what division within the Department of Health or health department here, the district, handles opioid issues and drug issues. Are we focused on treatment? Are we focused on prevention? Are we coordinating with other agencies, law enforcement, school districts for prevention, social health services for mental health, right? Are we doing those things? If we're not doing those, then I guess what I would propose, and I've done this in the past, my proposal didn't even get a second, but I'm going to try again, and I'll come back next month. This board does not like being caught off guard, but I'll come back next month with a written proposal to ask the chair to form a committee to maybe study what more we could do. We're talking about 30% of preventable deaths in our district. So my question for you is, even the issue, Dr. Wallace, of being able to collect data, there was a law passed. I've talked about it before. I don't have the RCW in front of me. It passed in January 2021, prohibiting local health jurisdictions from collecting health statistics, including death data. And so that's why you're seeing this latency of 2 to 3 years. We're not even in control of collecting our own data. How do you propose to get around that requirement? Thank you.
Yeah, I really appreciate that. I agree with a lot of what you have said. This is a public health crisis. There is a lot that we're doing, but I would say we're not doing enough. So as a local health district, we could be doing more. We can't provide direct treatment. That's, I think, beyond the scope of our department, but we can do better to collaborate with those folks that can expand access. And that's certainly our plan to do that. We do have a strengthening epidemiology group within our department. And so I want to work with them on identifying what data is most meaningful, cleaning that data so it's actionable, and then being able to use that to guide our response and share what we can with our healthcare partners. So a big reason that we don't have access to that DOH level death data is for privacy reasons, and it can't be made public, but we're working on ways to gain access to that data in a way that we can actually analyze it and use it to inform our response. Right now, we're unable to do that, but we need to do complete the data sharing agreements and access request for access that we need to do in order to obtain that data. Short of that, there is still a lot we can do. We've got good relationships with our healthcare partners. We've got really good relationships with our behavioral health organizations and our community partners that are more active and on the front lines of working on the opioid epidemic. And so the more we can collaborate with them, the more they can share their anecdotal experience with it, which I think goes a long way and has gone a long way, but we can identify what information we can gain with them to analyze and serve to be a more objective guide for us in our services. We've been working more and more closely with county coroner's offices and 911 dispatch. And those resources are especially helpful in real time because they can get at least numbers to us, but we'd like to work on those relationships so that we can get more detailed data and do more investigation into specific overdoses and specific trends that we're seeing.
Dr. Posey, did you have a?
Yeah, I would just add that funding wise, we have for the first time this year got someone that is focused on mental health and substance use, and that's through our Foundational Public Health Services funding. So it's that's part of it too, is just having the ability to hire someone into a role that is able to look at the data that we have, but also make the connections and be informed on the topic a bit more. And so that's been a real, I think, positive thing about that funding mechanism. So that's part of it's just this year, even though our CHAs every couple of years have said mental health substance use are an issue. It's just a capacity thing too.
Yeah, and Mon, just to be clear, it's not a criticism of what the district is doing. It's just a statement that maybe we need to reevaluate our policy and our priorities and what maybe we could do better. Especially, like I say, along the lines of prevention. There's no prevention. I have 3 kids. There's no prevention going on. Those programs have died and gone. You know, how we coordinate with law enforcement, right? Some of the charities, etc. Dr. Wallace, I'll just point out, though, on the data collection, you'd mentioned there that it's being protected as an issue of privacy. That's a ruse. That is, and we've talked about this before. That's a ruse that they use to close hold that information at the state level. I've given my theory why. It's because it's hiding. Frankly, it's hiding the COVID vaccine damage. But it's all done under the auspices of privacy. And I'm just going to remind everybody here: statistics are not protected by the Privacy Act nor HIPAA, and so statistics are not in and of themselves subject to privacy measures. Thank you.
Any other questions for Dr. Wallace? Anybody online?
Yeah, this is Joey Hunter.
Joey?
Dr. Wallace, you were talking about the low ED visits compared to the overdose increase, and we collect Narcan data when we distribute it. We put a survey on each box that we get about probably less than 5% of the people who access our vending machines actually complete the survey. But one of the interesting facts from that data is that 60% of people that overdose in our county do not call 911 and they do not go to the ED. These are folks that are reversing their overdose and going back to that lifestyle that they're currently trapped in. And so as our ED visits are low, it's just showing that people are not going to the ER. They're reversing that overdose on their own. We've had over 180 overdose reversals in our 4-county region. I have a bunch of data that I would love to present to the board with Garth Donald at some point. We've been looking over some of this data that really paints a picture that I think the community would like to see and also our board would like to see. But I'm also in agreement with that we can create a committee to look at some of this. I know our overdoses per the coroner. Hold on, I got to mute for a second.
Oh.
Well, while he's muted, I'll just say that the work that the recovery coaches and recovery network is doing is phenomenal. There is a lot of strong work being done to prevent more overdoses than we are seeing. So prevention is very strong, and it could be stronger. It'd be great to have organizations like the one Joey works with and other partners present to the board to share more of their experiences, what they're seeing. So I'd like to be more than willing to share some of my time for some of those folks to come and present the data that they have. And the lessons learned. So that just little bit of information that 60% of overdoses are not being reported to EMS or 911 shows us that the data we do have is just a tip of the iceberg, and there's a lot more going on out there that we're unable to track. And when we can't track it, we can't do as much about it. But having input from these partners like that is a tremendous help to us.
Sorry, my kids were about to have
Go ahead.
a blow up. But yeah, I just, this is one of the reasons that I'm super grateful to be on this board is the lived experience that I carry on this topic specifically. And I would like to hear maybe next month if we can get a committee together to be able to find people that are passionate, whether you're on our board or maybe even people that are a part of the health district that would like to have input on this, on things that we can do from the public health standpoint. I really love the prevention aspect of it. I think we do really well at pulling people out of the river, but we don't really do well at going upstream and seeing why people are falling in, and youth is where we really need to focus a lot of that energy on. If we really want to put a lot of focus on one area, I'd recommend it be prevention. The crisis is only getting worse as the fentanyl is flooding our communities. We had 10 overdose deaths in a 2-week period, just a matter of, the beginning of December, in Chelan County. And so, I did speak with the coroner and just to put a number out there, the 2023, we had 19 deaths, and 2024, we've already accumulated 32 deaths. So we're getting close to being double of what we had last year, which is a very big increase in my opinion. And I think also the community would love to have Wenatchee and public health really declare this as a public health crisis. Just to know that we're on board with supporting this stuff that's going on in our community and recognizing it as a problem, just like we've done with other pandemics.
Thank you, Joey. All right, any other questions for Dr. Wallace? All right, thank you, doctor, appreciate your time.
Can I ask a question?
Oh, I'm so sorry, yes, go ahead, Sharon.
What were of Joey? What were the years and the deaths that you just listed?
That was
Like,
2023. It was 19 deaths. In 2024, 32 so far.
okay.
That's just Chelan County. That's not Douglas.
Are there deaths that are occurring that we are not even aware of?
I'm sure at some level there is. It's really difficult probably to track every death that happens when it's a drug related overdose, but I guess, factors like, is this somebody who's been struggling with fentanyl and they have an overdose? It's probably a fentanyl overdose. And then I'm pretty sure they do testing around it as well to figure out specifically what drug the overdose was from.
But you don't get all of that information?
No.
Thank you very much, Joey.
All right, thank you, everyone, for the
quick comment over here.
oh, sorry, I'm so sorry.
Just further on what was on the discussion, we have to think about trying to share, having Joy present this data. I think that would be a great idea for January if it's possible to put that on the agenda.
Yeah, well, the executive team will look at it with what we have and talk with Kristen. So, yeah, thank you. Okay,